Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Renal cell carcinoma. Renal cell carcinoma is associated with paraneoplastic syndromes. So paraneoplastic syndromes seen in renal cell carcinoma are seen in 20% of patients. Number 1, raised ESR. Raised ESR is the most common paraneoplastic manifestation is raised ESR. That is most common, followed by there can be hypercalcemia. Why is this hypercalcemia present? It is due to paratharmone related peptide. This is related peptide. Due to paratharmone related peptide, we have this hypercalcemia. This paratharmone related peptide will act almost similar to the paratharmone. Paratharmone causes increased absorption of calcium from the kidney, from the GIT, thus causing hypercalcemia. So this hypercalcemia is manifestation of a paratharmone related peptide released by the renal cell carcinoma as a part of paraneoplastic syndrome. If you were asked what is the which paraneoplastic syndrome medical therapies are useful, so hypercalcemia is the only paraneoplastic syndrome where treatment can be given or medical therapies are useful. So medical therapies are useful only in hypercalcemia. Other complications are the patient will develop hypertension. Why is there hypertension? Because the tumor will produce renin. So when the tumor produces renin, so renin is responsible for hypotension. Similarly, because renin causes, why? Because renin, whenever renin is produced, renin activates angiotensin aldosterone system. So as a result, there is increased angiotensin production. There is also increased aldosterone production. Aldosterone causes absorption of salt and water along with vasoconstriction. Due to the combined effect of vasoconstriction and absorption of salt and water, hypertension can be seen. Then the tumor also produces erythropoietin. This erythropoietin is causes increased, this erythropoietin is produced by the renal cells. So this erythropoietin will act on the bone marrow and increases the RBC production, resulting in polycythemia. Then the other paraneoplastic syndromes is we have Stauffer syndrome. What is this Stauffer syndrome? This Stauffer syndrome mainly occurs, it is a non-metastatic hepatic dysfunction. So here there is hepatic dysfunction is seen, but it is not due to metastasis. Then why is it? This is because of the increased or raised interleukin 6 levels. So what happens is tumor produces interleukin 6 levels, and these raised interleukin 6 levels are responsible for hepatic dysfunction, which leads to the increased ALP and prothrombin time and bilirubin. So because of hepatic dysfunction, there is increased ALP, increased prothrombin time and increased bilirubin is seen. Then hepatic function also normalizes after nephrectomy. So this is one important thing, because after nephrectomy, after removal of tumor, obviously interleukin 6 level will be normal. So obviously this hepatic function will be normalized. If you see other paraneoplastic syndromes are, the patient can develop Cushing syndrome, hypoglycemia, the patient can develop anemia, gynecomastia and amenorrhea. All these are seen as a paraneoplastic syndromes.
thank you and thank you for watching.